Okay, last thing. Let's talk about contrast media reactions. And these are going to be actual reactions, not side effects. And there's a couple different ones that I need you to be familiar with. First of all, let's talk about the two types. There are local reactions and systemic reactions. And you can kind of tell from the name what is going to be affected in these two types of reactions. But let's look in more detail. So first, let's talk about local contrast reactions. They affect the site of injection. Normally, we're injecting in the antecubital region, so that's the elbow, the anterior elbow region of the arm. The first example of local contrast reaction is known as extravasation. And extravasation is the leakage of contrast outside the vessel into the surrounding soft tissues. And this is also called infiltration. So why does extravasation happen? Well, there's a couple of reasons. Maybe that blood vessel is weak and under the pressure of injection, one of the walls of the vessel kind of ruptured and got a hole in it. Maybe when you were starting the IV, you advanced the needle too far. You advanced it all the way through the vein and then retracted it a little bit. Well, now there's a hole on the other side of the vein where contrast can leak out. So there's a number of reasons why this can happen. This is pretty common, actually. Maybe pretty common is too strong. This happens fairly frequently, I would say, especially in patients who are maybe elderly and don't have good veins. So, as the technologist, when you are injecting, you will be watching that injection site and you will see extravasation right away. The patient will get a large lump. And what that is that's that contrast pooling in the soft tissue outside of the blood vessel. And the patient often reports pain. So they'll say, ow, 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 that hurts, What you need to do is stop the injection immediately, okay? If you can, you're going to want to take pictures because the contrast is going to the kidneys within a minute. So if you need to take pictures of the kidneys, take pictures of the kidneys right away. After your imaging is done, you're going to want to elevate the extremity, give the patient a cold compress for pain, instruct them when they get home to apply a warm compress, and that will help the tissue to absorb the contrast. Always document this in the patient's records. Oftentimes, the radiologist will want to know how much contrast do you think the patient got before you had extravasation. So just be mindful and try to guesstimate that if you can, and document everything, including your response in the patient's records. The second type of local contrast reaction is called phlebitis, and this is very simply an inflammation of a vein. So the patient will have pain, redness, and swelling. And this isn't something that you're necessarily seeing right away. The patient may experience this the next day or later that day after they've already left your department. In any case, if you did notice anything like this, you certainly document it in the patient's records and then give them the same care as you would for extravasation. If a cold compress will help with pain, instruct them to elevate their extremity, etc. While extravasation can be painful and phlebitis, and it's kind of a pain in our butt because it kind of interrupts our imaging sequences. These contrast reactions are manageable. They're not life-threatening. We get more concerned when we talk about systemic reactions because systemic reactions affect the entire body. Systemic reactions are classified into three categories: mild, moderate, and severe. And I promise you, this information will be on the test. There is a long list of mild reactions, moderate reactions, and severe reactions in Bontrager. We will practice with this information in lecture, but I need you to be familiar. So make flashcards, make a chart, whatever you need to do. Make sure you're familiar with what type of reaction is mild, what is moderate, what is severe. So for example, I am looking on page 541 in the 9th edition of Bontrager. If my patient has nausea and vomiting after contrast administration, that is considered mild. Even though to you and I, like vomiting, whoa, is technically considered a mild reaction. If my patient has severe urticaria, well, what is urticaria? Urticaria is hives. If they have severe hives, that is actually considered a moderate reaction. If your patient has laryngeal swelling and it's advanced to the point where they're not breathing, that is a severe reaction, okay? So please refer to page 541 and make sure you are comfortable identifying the different types of reactions. All right, you guys, this is a lot of information. If you have questions at all, please don't hesitate to reach out. I'd be happy to talk with you about this some more. So thanks so much for your time, and you guys take care.